Caitlin, thank you. Now, for many people, dangerous opioid addictions begin at the hospital when they're prescribed to manage pain after surgery. But a new approach by doctors at The Ohio State University is reducing opioid use among surgical patients in the hospital and at home by half. Jen Picciano explains the opioid-sparing route doctors are taking that is changing and possibly saving lives in this 19 Health Alert.
The data's out there, right? The stories are out there. I think probably all of us know someone who's been affected by that, and it's terrifying.
When breast cancer patient Britt Collier Gibson needed a second surgery, she was relieved to hear that her doctors were going to treat her pain with fewer opioids.
That suited me well. I didn't know how painful it would be. It was a different type of surgery. It was a more lengthy surgery, but I wanted to give it a try.
The opiate crisis has definitely brought awareness to this and caused us to reevaluate how many opiates we want to use.
Doctors at The Ohio State University's Comprehensive Cancer Center are taking an opioid-sparing approach to post-op pain management.
The nature of giving opiates to patients, even if we have a very good reason, that can ultimately lead to bigger problems with diversion, addiction, misuse, and abuse.
According to university hospitals, more than 60% of opioid abuse and addiction starts from appropriate, legally obtained prescriptions or through family members who have those pills left over from those doctors' prescriptions. Dr. Michelle Humidian, an anesthesiologist, says opioids can also cause nausea, lead to trouble breathing, and cause the GI tract not to wake up as fast after surgery.
This has become a standard in our society that you get pain medication. After this procedure and that procedure, you get that amount. And so in a way, I was almost challenging it, like, well, maybe I don't need that amount.
You can use the other adjuncts like acetaminophen and regional blocks to decrease how much opiate that you're using, which helps the patients recover faster with really good pain control still happening.
Their innovative approach is working. Dr. Humidian, who leads OSU's initiative, says the data shows that using non-opioid pain management options is resulting in less pain, less nausea, shorter hospital stays, and reduced costs. Since their opioid-sparing approach started in 2016, they've documented a 25% reduction in average post-surgical hospital stays and a 50% reduction in opioid-based pain medications, both in the hospital and at home after surgery.
We want to be really mindful and use opiates as needed, but to really maximize our other options for pain control first and use opiates as a backup plan.
Dr. Humidian says they aren't eliminating opiates, but instead being more selective about when and how they prescribe them.
And really reserve those for situations where we've maximized all the other things, even though that takes a lot of coordination and effort to do. Certainly worth it.
What started as a pilot program is now being expanded to post-operative care in 10 other programs at Ohio State, sparing opioids and, in some cases, lives. Jen Picciano, 19 News.
And at university hospitals, their colorectal surgery service has been certified as a center for enhanced recovery after surgery, one of less than 10 in the country. Their protocol at UH has resulted in a 63% reduction in narcotics prescribed at discharge.